channel. In today's video, I'm going to be talking about the structure of the ACCS program, the different types of specialties that offer the ACCS program, what are the differences in all of the three, and what are the pros and cons, and most importantly, some of the common misconceptions which are related with the ACCS program that is now part of the UK training system. Alright, so let's talk about the basic structure of the program. It is a 4-year program. Yes, that is correct. It's a very long core training program. It is the longest core training program you can find in the UK. Most core training programs end at 2 years, but this is the only one that lasts 4 years. And the reason is that you are going to be rotating into anesthetics, ICU, ED, and acute medicine in the first 2 years of the program. And then the remaining 2 years you're going to be doing in your primary specialty for which you have applied for which your training application and interview went through. So this is one of the most important things that I wanted to talk about, is that a lot of people think that once you get into ACCS, that's it. There's only one application that you have to go through. And if you're into it, then that's fine. You've got into training and well and good. But that's not correct. The ACCS program is not a separate program. It is basically an option that you get if you're applying for anesthetics, ED, or acute medicine. By which I mean that if you're applying for, say for example, anesthetics, and you've passed your interview and you've gotten a job, if you've ranked ACCS, then only will you get ACCS, and you're only allowed to get ACCS in the anesthetics application. Say for example that you apply for IMT, but in IMT, which is the medical training, if you apply for IMT and you did not put ACCS applications in there, then you are not going to automatically get an ACCS post for IMT. Same goes for ED. ED only has ACCS, they don't have a core or ACCS option. So whether or not you've applied for a run through or just a core training post, you will be provided with the ACCS training number if you have applied for an ED post. But I'm sure that you are now very confused by what I've just told you. And this is why I've made this video. So I just want to clarify that if you want to do ACCS anesthetics, then you have to apply for anesthetics application, do the interview, do the MSRA, do everything you do for anesthetics, and at the end, when you rank your posts, that is where you will choose ACCS instead of core. Same goes for acute medicine. So if you want to do IMT, then you can do IMT from the IMT training number, or you could do ACCS for an acute medicine post. These are not combined training numbers. These are not combined in the same application. So a lot of people think getting into ACCS is easy because they're looking at scores for IMT, or sometimes they're looking at ED scores. But that is not correct. If you're looking at ACCS anesthetic, it is a highly competitive training post to sought after, and you will be going through the anesthetics training pathway. That means after the MSRA, you have to take the anesthetics interview, and you'll be applying to the anesthetics training system. So a lot of people apply, and a lot of people I know have a lot of questions about this. I just wanted to clarify this before we start talking about the pros and cons of the ACCS program, because this is the fundamental issue that I have found. A lot of people think that once you've applied for any of the ACCS, that's it. You can interchange, but that is not correct. It's pretty self-explanatory, but a lot of people have this concept. Therefore, I wanted to make this video. Alright, so why are these named same? Like, why is ACCS anesthetics, then ACCS acute medicine, then ACCS ED? Why are they all different? What is the difference? Why can't I just apply for one ACCS and interchange amongst everyone? Because the first 2 years are designed in a way sort of linking with your primary specialty. For example, if you are someone who's doing ACCS anesthetics, then your first 2 years, the first year is going to be ED and acute medicine, the next year is going to be ICU and anesthetics, and from there onwards, your third and fourth year is going to be your primary specialty, which for me obviously is anesthetics. But if you're an acute medicine trainee and you apply for an acute medicine post and you've got an acute medicine ACCS training post, then your first year is going to be anesthetics, ICU, and ED interchangeably. Somehow people think that is the same thing, but it's not, because the competencies that you require for anesthetic training is different to obviously the other ones, and you can't switch in between all of them. Previously, it was the case that you could switch between all of them, but nowadays it is not the case, and that is something that I absolutely wanted to clarify to everybody who wants to try for the ACCS post. If I want to tell you about the competition ratios for each deanery, sometimes there's one or only 2 ACCS posts. For anesthetics, that is what I know. For the rest of them, obviously for core training and other training posts, there are more posts than ACCS. So obviously, yes, ACCS slightly competitive in anesthetics. However, a lot less number of candidates want those seats because of the extra added year. But because lately a lot of people do want to dual train into ICU, and this is the most straightest pathway you can do ICU through anesthetics, this is why it has come sort of into like a little bit of, yes, everybody wants it, everyone wants to have it kind of a situation at the moment. Alright, so now that I have made it clear that the ACCS pathway, although looks pretty similar on paper, if you want to get into the anesthetics one, you have to apply through the anesthetics ORIEL. If you want to go into the acute medicine one, you have to apply to the acute medicine, and same goes for ED. The only thing that I want to mention here is that all of these applications have different criteria and they have different interviews. So if you do want to apply to any of them, you will have to basically appear in 3 separate interviews of 3 separate structures if you want to go into an ACCS program. So you've got a good chance. I mean, 3 programs, 3 applications. If you work hard enough, you will get into one of them, but that does not mean that one of them equates to the other one because your competencies are different. I hope that clarifies all of the questions that I have been receiving about ACCS. Right, so I hope that I've made that clear. Long story short, ACCS pathway is not a single pathway, it is not a single application, and it's not a single interview. All of these things are very, very important when you're trying to decide how you want to apply for your ORIEL pathway, which training program you want to apply for, and obviously what kind of interview is going to be coming if you actually want to enter any of these ACCS pathways. In summary, you get an extra year as a core trainee, so you've got 12 more months to pass your exams, 12 more months of training in 2 different specialties which won't be your niche. You'll be training in allied specialties which you obviously would not have worked before in, so it does give you a little bit of an edge when it comes to experience and skills. But nevertheless, yes, the pathway is 4 years. Yes, you have to go through all of these tests, exams and interviews. And yes, they are separate. They are definitely separate pathways. They are not the same. So if you meet an ACCS trainee, do not assume that they are ED because they might be acute medicine or they might be anesthetics and they might be wanting to do ICU in the future and therefore they have decided to do this pathway. I will be coming up with another video talking about the core anesthetics and ACCS anesthetics and which one I think is better or worse, or basically which one you should be choosing. But for today, I wanted to make a short video explaining what the ACCS pathway is, what it stands for, and basically what is its structure. I hope that you guys like this video. Give the video a huge thumbs up and subscribe to my channel if you have not already, and I will see you guys in my next video. Bye!